Hi, good afternoon. I have to say that when I was given the opportunity to speak this afternoon, I had no hesitation at all in wanting to share what I believe is our collective success. We've had over quite a considerable number of years now partnership working in Scotland. I kind of have a dual hat at the moment, so I work for ROSPA. I'm head of ROSPA in Scotland, and I'm the current president of IOSH. So as I go through and talk about successes, I'll talk about them from what ROSPA's achieving or has achieved, and also IOSH has achieved through working in partnership with our network in Scotland. I keep looking around, but it's written in front of me, so hey, how good is that, you know? So I very seldomly reflect on very much, you know, I'm sort of very much for not looking back, very much for looking forward and seeing what the next steps are. But I did, when I was putting this together, just reflect on, you know, these letters after my name. It's all very well, you know. However, after this morning's session, I'm thinking, well, how can I engage? I engage very effectively with the membership I represent in IOSH. However, I don't do so much influencing within CIPD, so I must think about how to do that differently. And the same as AIMA, how can I get more involved there and to try and get our health and safety messages more effectively understood within these not inconsiderable professional bodies, and that was a topic that was mentioned as part of the feedback from this morning. It also says MSP, that's a Masters of Safety Promotion, you know, so it would be impossible, I feel, to do it all. When I reflected back this weekend as I was putting this together, I very much feel that Scotland's Health and Safety Network has very much got a tradition of engaging in terms of strategy. And I stand here revitalised and also part of the solution this afternoon. The revitalisation agenda was the spark, I think, for partnership working in Scotland, and that brought into being the Scottish Health and Safety Revitalisers Forum, which Ian Tasker, I had a look at the list of people who were part of the Revitalisers Forum, which ran from about 2000 until 2003, and the people who still, I'm not saying the rest of us have left us, the rest of the people have left us, Ian Tasker, myself, and Ian Waldron, who some of you will know, were very closely involved with the Health and Safety Revitalisers Forum, and then met with Alan Sefton, the then director of HSE Scotland, to look about bringing together the partnership on health and safety in Scotland, which I believe, having been a member since its outset, has certainly simplified complex messages and really provided an opportunity for people to get together within a Scottish context, and that's without the social dancing. I think the simplifying complex messages, you know, this morning, you know, you come in, we're at strategy discussion, you know, it's sort of heavy duty, we want to give our best, but to have it distilled down into these sort of pictograms and sort of short phrases that allow us to engage quickly in what is a relatively short period of time is also sort of exemplary. In terms of the Partnership on Health and Safety, George is indeed the chair, and the aim of the partnership, because the reason I'm just going to go through some of these short forms is sometimes people go away from these events and say, well, they've never asked what FAS stands for, what does it really do, or what does PUSH stand for, what does it really do? So I'm just going to do it quickly and then let you see how it all fits together. Essentially, FAS aims to implement HSE strategy, which it has done since revitalising health and safety. Within the context of Scotland's economy, its industrial makeup and culture is action-orientated. Sometimes there's a wee bit more action than others. It has a very clear focus on health and safety, and it aims really to coordinate action between partner organisations. And I was delighted when I got the list of people who were attending today to see that we do have potentially new partners here, completely different organisations that I've been used to engaging with around these themes, which I think is hugely positive. So I think that'll give us a new impetus, and there's been a lot of reference recently at the most recent FAS meeting and in between times about links to the Fair Work Convention, which I think can only be positive for us as time progresses. In terms of where I work, this is where we all work. This is Scotland's Health and Safety Network, and you're not meant to be able to read it, okay? You're not meant to be able to read it, so don't worry about it. For me, and as I do a bit more travelling than usual, I've got the huge privilege of going out and telling people all around the world now how well we do things within the UK, and a little bit of additional pride about how we achieve things within a Scottish context. So you're really not meant to be able to read that, but what I hope you get from that is a sense of the numbers of partners, the combined energy that we can all achieve change as a consequence of bringing ourselves together around specific topics and themes. It's kind of like a school chemistry lesson. You know, you get your nucleus and then your energy levels, and I just think the more energy at the centre, the more we can all achieve as an outcome. The group that I represent on FAS, the Partnership on Health and Safety in Scotland, is PUSH. PUSH is a grouping professional organisations in occupational safety and health. And we meet together representatives from all the professional bodies that are engaged with the process, which include IOSH, the Scottish Centre for Healthy Working Lives, the HSE, British Occupational Hygiene Society, that Association of Chartered Physiotherapists in Occupational Health Ergonomics, the Chartered Institute of Ergonomics and Human Factors. Yeah, they all exist within a Scottish context, and they've all got members that we can engage with to make things different for our nation. We're in the process of revising a mapping exercise that will identify how many members we've got within each of these professional bodies, where in Scotland located, so we can identify where the gaps are and start meeting the requirements of perhaps rural, local needs in terms of professional support. So we're in the process of doing that at the moment. One little group, one group you won't see on the map there because it's not been refreshed. We've got a new a body within Scotland, Scottish Waste Industry Training, Competency and Health Forum, which is a bit of a mouthful, but SWITCH is the short form, so that's really good. And they have come together quite rapidly, I would say, using the sort of partnership networks that already exist within Scotland. And I know we've got representatives of SWITCH here this afternoon. They have produced a very interesting sort of short article that is available called Time to Switch On, that I'm sure Fiona Craig would be happy to make available through the organisers. So if you want to know who's involved, if you want to know how to get involved, this sort of short form of information will certainly assist you with that. I mentioned, everybody knows we've had a previous Scottish Action Plan, and from my perspective, and it's very much a personal perspective, I believe the Action Plan was the thing that brought us all together quite swiftly around common themes in order to move us forward, to make success, to drive success forward across Scotland in relation to the Action Plan topics. Now, this afternoon, you've got this phenomenal opportunity to influence what the topics are for the next steps. But what I'd like to do over the next couple of minutes is just to share some of the successes with you. And I changed my slides earlier on today, so if you don't, just bear with me for a moment till I make sure I'm exactly where I should be, and I am, so that's good. The Scottish Occupational Road Safety Alliance, driving risks at work is a major challenge irrespective of where you are within the world. And through the Scottish Action Plan, we established SCORSA, which essentially looks at facilitating networking between businesses in relation to the very specific topic about driving risks at work. And again, this topic was brought to ROSPA by Ian Tasker and his colleagues, again, looking at those who drive for work. And it very much encourages joint working to raise awareness in the organisations about the need to actually work on the topic of occupational road safety. It promotes the exchange of information on new initiatives and best practice, and really quite interestingly contributes towards the delivery of Scotland's road safety framework to 2020. Because as employers, if you've got people who drive for work, if you can exercise a higher level of control and reduce the impact of negative driving behaviours and associated accidents, we can actually contribute to reaching Scotland's road safety targets, which is a very privileged position to be in. SCORSA produces a whole range of resources, so if you're sitting there thinking, managing occupational road risk, I wonder if we've got a policy on that. Driver handbook, goodness me, when did I last see a driver handbook? How would undertake a risk assessment or look at managing the risk associated with those who drive for work? Or what about those people who drive for work in their own vehicles? The SCORSA website provides free to download information for each of your organisations, and with the option to add your own company logo. So we're making it easy for you. The action plan has delivered something that's excellent. You know, it's very easy for you to interface with, but also makes it easy for you in terms of the next steps. We also have linked to the driving work risks at work arena a toolkit that's available through the Healthy Working Lives website, so you can actually take people through a training programme in relation to driving risks, and sort of have evidence then that you provide the training and support in order you can improve the standards of driving within your organisation. Another particular success that we have, and when I say we, I mean us, that's what I mean, you know, as us collectively, is the ROSPA Scottish Hire Performers Forum. For approximately the last 15 years, we've been bringing together twice a year organisations that are either ROSPA Award winners, Healthy Working Lives Award winners, or organisations that have been involved with HSE case studies. And we bring these organisations together on the basis that companies that want to achieve excellence in health and safety performance represent this kind of considerable reservoir of real commitment and expertise, which should be channelled to help raise awareness and standards in workplaces throughout Scotland. And again, that fits in with one of the themes of the new strategy as we go forward. These organisations just waiting to be asked to help you. You know, they're keen to share, they're keen to exchange information, and they tend to be very positive in terms of responding to getting engaged with research. For example, the ROSPA HSE research on worker involvement, what works, it was carried out in 2010. All the case studies there came from higher performers who were really interested in making that difference. The really interesting thing is the Scottish Hire Performers Forum is to be extended across the UK, managed through my colleagues in ROSPA in Birmingham, because this excellence forum, there is this thirst to share and exchange, and we recognise that, and that opportunity will be available to organisations across the UK from June. What do we like best about the Higher Performers Forum? Well, certainly the improved networking, you know, knowing who to phone, who to pick the phone up to, and sort of say, I've got a challenge with nail guns, I've got a challenge with dust, who will I speak to? Right, I know who exactly is going to be able to help me with that. It certainly is beneficial on a personal basis because it provides an opportunity for managed career development in CPD. And those of you who are IOSH members out there, I hope you're all currently in good standing with your CPD. It certainly provides a focus, as I say, throughout the year for these organisations to consider how they can influence their supply chain and communicate standards, very much a model for low-cost development, which I think is fundamentally important as we move forward, because one topic that hasn't been talked about in any great detail today is the funding that we have available to move everything forward to the next step. So those are two initiatives that were linked to the original action plan. I'd like now just to tell you about an IOSH and Healthy Working Lives initiative that was launched in October 2014, Managing Stress Train 2015 Challenge. At our discussion table this morning, you know, the burden that stress and mental ill health places on Scottish workplaces was discussed in some detail. Mental health problems at work costing Scottish employers over $2 billion a year. I personally haven't got a clue what $2 billion looks like, but if it was $1 billion, if it was $500 million, it's still too much. The average work-related stress absence being 24 days. So IOSH, through IOSH Scotland network that is supported by Glenys Neville, our networks officer there, we worked closely with match funding available from Healthy Working Lives, provide free training to assist employers in training over 2015 employees during 2015, you get it, to identify how to manage stress and mental health issues in the workplace. And as it was discussed at our table, you know, there's a lot of hesitancy about opening that box around sort of mental issues within the workplace and stress-related considerations. So the aims of the course were very much to develop managers themselves to support mentally healthy workplaces through providing an insight into the key factors that contribute to a mentally healthy workplace, increasing awareness of mental health issues and the impact on the performance of staff and the performance of the organisation, and also how well staff engage with the organisation. The pivot point for all was the training actually providing an improved confidence in these people who were trained in recognising and dealing with poor mental health and well-being in the workplace, and including possible reasonable adjustments. It also provided an opportunity to be introduced to some tools that could be used to support the managers' teams to identify and manage stress at work. And again, this programme is available in a virtual learning environment through the Healthy Working Lives website. Although IOSH is hoping to be able to work with Healthy Working Lives over the next year to provide more opportunities for the face-to-face training, because we believe the number of different interventions that you have, the more likely people are to engage with the overall process. In terms of the next steps, I really like this slide. I got this slide when I was doing a distance learning master's programme with the Karolinska Institute. And if you like a slide, you just like it. So I hope you like it as well. Essentially, this is to let you understand the influence that you can have. We're here today talking about workplace health and safety, and rightly so. But we've talked about friends, we've talked about families, we've talked about society, we've talked about how much everything costs. So when you're considering what your potential next steps may well be in terms of taking forward your own version of the action plan, you should really think about the fact that you can influence, IOSH, for example, have got practitioners who can influence across all of these areas with the concomitant benefits to society. So thinking about it in that particular way helps me vision what potential impact we can have if we work together or continue to work together as a community in Scotland. What I believe our shared strengths are, and the word catalyst has been used earlier, and I did try and find another word for it there, but I like the word catalyst. I haven't used the word journey at all, because I prefer continuum and I want to dance when I hear the word journey, So, I think our shared strengths are very much in encouraging each other. And I think our strength going forward will be to assist the HSE in delivering their strategy within a Scottish context. Oh gosh, sorry, I had a next step slide, so I'm just going to go with it. In terms of what I'm going to commit to do, I am going to take back to IOSH the very positive messages from today. I'm going to work with IOSH in Scotland in relation to their initiative that's called A Man in a Van, which has come out through the IOSH Scotland network, and it's about not expecting the small businesses to come to you. It's about us working in partnership with a major utility in Scotland to take a man with a van out there to sort of start providing interfaces on a much more local basis. So Scotland, we're challenged by our geography, we're challenged by our population spread. This is one way testing how we can get closer to the working population. I'm going to work with IOSH in terms of continuing to raise awareness of No Time to Lose, the Silica chapter of which will be launched on the 16th of March. And I'm currently working with ROSPA, because I do some work with them, on a consultation in relation to the health and safety needs of apprentices because of the upsurge in apprentices that are available across the UK, and how are the health and safety needs being met. And again, we're speaking broadly about that, particularly to higher performers, to distill down good examples of what works well in order we can share success, which again ties in with the future strategy for the HSE across the UK. So thanks very much for listening. I hope I've given it the positive. I hope you can feel how positive I feel about it. I'm very much looking forward to the next steps of working with HSE within a Scottish context, and indeed a UK-wide context, to improve standards for people who work for us within the UK. Thank you.